what's going on with the dip? Why does the dip happen? Is there something that people can do to prevent the dip?
Just to be clear, you're talking about the dip in terms of depression or burnout?
I'm talking about depression.
I wish that there was a way that we knew to prevent depression. And we know that there's healthy habits that can mitigate depression, but depression's an illness. And when depression shows up early on, maybe we can mitigate by exercise, diet, socializing, all the healthy habits that we know about. But once depression has reached a certain point, people have a hard time activating themselves to the point that they can use that. So early on, that may be something that's possible. And for some people who have kind of this genetic predisposition towards depression or getting depressed, there may not be a lot that can be done other than some sort of treatment.
That actually brought up a thought. Because you guys are doing the accelerated version and it's happening in 6 days, are you dealing with a dip, right? Because when you look at standard TMS, you're doing 36 along the ray, 1 day, 1 session a day. Typically 2 to 4 weeks, people are experiencing the dip, right? But because you're doing it in 6 days, are you even experiencing that? Or your clients experiencing the dip?
So by a dip, again, just to be clear, you're talking about a dip during the course of TMS?
Yes.
Yeah.
I feel so good. I draw a squiggly line going up, right? And I say, you're going to feel great. You're going to feel great here. You're going to come here. You're going to say, Kyle, it's not working. But if you got up here, you're going to go up here. That's kind of the dip. And that's how I show people the dip of what they can expect, right? But my thought right now is if you're doing it in 6 days, are you even going to experience that or notice it? Yeah,
so people can get that variability in mood over the 6 days. So, first day, second day, you may be feeling better. Third day, fourth day, you might be more tired. And with the standard protocol, we get that as well. How we help patients through that is really the TMS technicians that we have here. They're all very, very experienced. They've seen hundreds of patients go through this. And the TMS technicians are invaluable. They're the ones that are seeing the patient every single day. Besides providing the treatment, they're like the cheerleaders. Hang in there. We see this. It's going to be okay. Keep coming back. I've talked to other TMS providers out there, and there's a drop off during a 36-session standard protocol where people just kind of give up. It's not working. It's not, we are incredibly fortunate with the team that I have here that most people will complete treatment.
Yeah. I love that you use the word cheerleader. And that's when I went through my TMS stent, my first TMS stent. That was exactly how I expressed when I was talking to the doc. I said, man, your cheerleaders here are amazing. And they really help you come back and support you through this. And I think a TMS tech is invaluable, right? Because just like you said, they're the ones in there. They're the ones seeing you, interacting with you every day. And they become part of your life.
Yeah.
When I'm driving down to get to my session, I can't wait to see Bethany or whatever the person's name is, right? It's so important that you have a great tech that's helping you through this process. Do your technicians, have they done TMS themselves?
None of ours have done TMS themselves, but I was just thinking our techs get flowers from patients, right?
That's right. Gifts. Yeah. It just shows, the level of care is so important. People are tender coming into TMS, going through TMS. And again, that technician is so important.
They help people through the initial stages of TMS where the stimulations, we start at low levels that are tolerable and we want to ramp it up. They're very, very good at kind of nurturing people through the phases of increasing the energy that we're using over the course of the sessions.